Thank you for tuning in to this episode from the Riesberg Institute. My name is Dr. Michael Riesberg. I'm the owner and founder of the Riesberg Institute. I have on the show today two guests. One is Miss Autumn Moore. Autumn is my medical esthetician that does many procedures to promote facial health and total body health. And I have also a patient, Melanie Collins, who has had procedures done in the office for medical aesthetics. We're really excited. I always believe in introducing things that can help people be healthier. One of the most important things for all of us is to maintain our body, which is kind of like our temple. Nobody really has a way out of having to go to the work and effort to maintain good health. That includes muscle toning, that includes connective tissue toning. In my specialty, I'm one of 4 specialties that is experienced with doing procedural treatments on the face as a physician. And many people think that we only focus on the face, like the head and the sinuses, but other areas are important for us too. We help treat sleep apnea. If patients are overweight, we can help provide the start or initiation of getting better toning, getting fat reduction to help with that too. For balance disorders, a lot of times it has to do with lack of muscle toning. We have procedures that can help get that started, and then recommendations that can get my patient into areas where they can work on building muscle and lean muscle. We're excited to introduce a product called SoftWave. We're one of only 2 practices at this point that has the SoftWave technology. SoftWave is remarkable for doing connective tissue toning on the face for areas that need smoothing. It also is one of the best treatments for smoothing out cellulite, which is a condition that can affect very fit people that can show a lot of the dimpling that they'd like to get rid of. So I'm going to have Autumn Moore explain more about the procedure that we have called SoftWave.
Yeah, absolutely. So SoftWave is a really amazing technology that we've, very recently adopted into our office. So it's a device that will actually affect the top layer of the skin. So we're going in only at 1.5 millimeters deep, so it's pretty superficial, so it's nothing that's going to affect any kind of top fat or anything. So it's great for pretty much every single type of skin. So there's no limitations as far as who can have it, who can't have it. So every skin type is able to actually have this procedure done to them with little to no downtime whatsoever. So you don't need to limit your sun exposure, which we all know and love in here in Florida. It's really great for all types of the year, so you don't have to limit it to just the winter time when you're not out at the beach or in the sun or anything like that. But it can really help with a lot of different issues that we see as we age. It helps with very specifically tightening and lifting the skin, but we're also seeing it really do a great job lifting the brows as well. And we're recently kind of starting to do a lip flip as well, so you don't need to go, if you don't like the thought of getting injections with whether it be the needles or the ingredients with filler, you can actually do this with your own body's collagen production, which is amazing.
Sounds great. And Melanie, you had the procedure done.
Yes.
And explain the experience and what you've noticed with your results.
Sure. I had the procedure done a little over a month ago. I had my whole face done. I was very nervous about having it done. I don't like needles, which is one of the reasons why I haven't done filler or Botox really. There were times that it was uncomfortable,
Sure.
but it's not unbearable. The recovery time was nothing. I mean, I went home, my face wasn't red, my face didn't have any evidence of having anything done to it. So it's something that I would definitely try again. And the results that I've seen in just 3 weeks has been incredible so far.
Excellent. And a point to be made is that there's not anything that replaces surgery, but surgery is invasive and requires a downtime and a healing time. not everybody is a candidate or a good candidate for surgery. And third factor is that not everybody needs surgery if they have subtler changes. And pros and cons with surgical treatment. Many argue, and rightfully so, that it may last longer. Although the soft wave procedure has shown good maintenance results after 1 year.
Yeah, absolutely. That was one of the biggest draws to the procedure, actually, is because you really don't have to, it's not a series of treatments or anything like that. You don't need to come back multiple times to kind of keep up a series of treatment like a lot of the devices that are rivaling surgery. You actually just, it's one and done kind of, and then they start to maintain, and all the clinical studies show that these results are building on themselves for about a year after. So that's, a year will be the soonest that you'll need that second treatment, which is amazing for a completely non-invasive device.
Melanie, how long after your treatment were you starting to see results?
I had the treatment done on August the 3rd, the afternoon, and I think about 2.5 weeks. At 3 weeks, definitely could see substantially, especially like through the lines around here, lines on my forehead, and even on my cheeks. So under my eyes several of my friends commented, we can really see under your eyes. So
that was where I noticed it
yeah,
at first. Yeah. And then looking at those before and after pictures, it was almost like, I was like, oh my gosh.
Yeah, my eyes look much more open than they were before.
Got a nice little brow lift out of there.
Yes, definitely.
Yeah, one of the differences between the soft wave versus the M-face, which uses electromagnetic on the muscle, most of the connective tissue problems in the face are connective tissue versus muscle related. So the advantage with the soft wave is that it actually addresses the connective tissue and not the muscle. And that's where you're going to get your best results. Whenever surgery is done, it's not done on the muscle, it's done on the connective tissue when they do facelift or brow lift. But it can be a good option for lifting the brows because it's not easy to know where to put an incision for a brow lift. It could be put on the eyebrow, which is probably the best place to conceal. But if it's above the brow, there'll be some type of visible scar. If it's done in the hairline, it's fine until the hairline recedes, then that might create visibility. And again, it's the downtime from having invasive procedures performed. One of the things I've noticed too is that when you talk about protrusions under the eyes, where for lack of a better term, people call it bags under the eye, some of the protrusions occur right below the lid line that surgical blepharoplasty can more easily access. But some of the protrusions are on the malar areas of the cheeks, so you would have to dive deep with an incision, which wouldn't be practical, whereas the soft wave can actually address that and smooth that out.
We're able to get right up to that water line. We're able to get that soft wave technology right there, so we can treat the entire orbital bone area, where it's a really the small handpiece that we have is really able to get in these little teeny tiny tight areas. We can do the full inside the brow, around the eye, and actually that's when we're able to do above the lip as well. So even in the smallest spaces we can really get in there and treat. And it's another great way because a lot of these non-invasive treatments for fine lines, we are kind of worried about fat reduction. So volume in the face is really important. When you show signs of aging, the first sign is normally a loss of hyaluronic acid or that volume. And you don't want to touch that when you're treating any kind of facial lines or anything like that. You really want to be careful to maintain that facial volume, and soft wave doesn't touch that at all. We're really just conditioning that skin to really lift and tighten.
And it's summer season, so swimwear, shorts. Explain about treating cellulite. Somebody comes in and they've been battling cellulite because they've been told wrongly that it's fat. It's not fat. It's kind of the difference between connective tissue being smooth and compression hose versus having fishnet type of connective tissue that dimples. But when somebody comes in for treating the leg areas for cellulite, what would that involve? Yeah,
absolutely. So cellulite is a very, very frustrating issue for a lot of people. It's very hard to treat. It's not something that you can just easily be done in the gym. So until recently, it was a very invasive procedure where they actually had to go in and break apart those structures right underneath the skin. So SoftWave's great too. We can just actually go in there and thicken up that couple top layers of skin. So it's not too invasive or anything like that. We're just going in there, strengthening up the top layer of skin, and so we're actually able to significantly reduce the appearance of cellulite without having to have an uncomfortable procedure or anything done. And again, there's no downtime, and we can treat anywhere on the body for that. So it's really customizable.
Very good. The other thing is appearance, and it's one of the few procedures, although we'll still caution a person, but whenever I do anything like Botox or filler, or we do any procedure that's going to affect noticeability on the face, we'll let the patient know ahead of time. If they have a big event coming up that night or within 2 weeks, it's better to postpone and do it afterward so that they're not visibly showing signs that they had the procedure done. I can't tell you how many times that's happened to a person that they were never told by their medical spa or their proceduralist that they were going to have visible signs afterward. The other thing that is very important, we do all the procedures within the office. I don't believe in doing procedures off-site. Being cool is not always being smart. It looks great, but our best area where we have the equipment, we have the personnel, is within our office. The other thing is that with some of the procedures we do, like Botox or certain skin procedures, or if you get procedures done in plastic surgery like liposuction, they're going to advise that you don't drink. And when Botox is done off-site and the person drinks alcohol, several things involved, but they can bruise a lot easier. And certainly you don't want the party atmosphere where you have a physician or nurses or medical staff. And so for those reasons, with some of our procedures, we advise holding off alcohol or things like Motrin or ibuprofen. With SoftWave, we haven't had to do that so much. And that's been one particular advantage that we have.
Yes.
But really appreciate being able to do that. In the next segment, we're going to talk about some of the other things that we do, including M-Sculpt and Morpheus.
Wow, Sir Richards is a great place to watch the game.
What? I'm sorry. I don't think I remember his name. It might have been Richard.
Are you missing out on voices and sounds around you? Do you answer people without understanding what was said? You may have a hearing problem.
Wow, home run!
What? Of course I'm having fun.
Call Riesberg Institute today and schedule your appointment for your hearing evaluation. Clearly, better hearing is a game changer.
Introducing M-Sculpt, body sculpt while building muscle. Ab sculpting and much more. Works on stubborn areas no matter what you do in the gym that just won't go away. Unable to exercise due to mobility issues? This powerful system works. M-Sculpt is the perfect solution. Look your best, feel your best, request Riesberg.
Welcome back. This is the Riesberg Institute. I'm Dr. Michael Riesberg, and I have with me on the show Autumn Moore, my medical esthetician, and Melanie Collins, one of my patients. I always believe whenever we add or do a show that we actually involve actual patients. I don't have actors do it. I want the real thing, you know, and them to be honest with their experience. And that really helps to know what to expect. When you have the procedures done, normally we use a numbing gel. And what was the experience like with that?
Well, Autumn will tell you I was very, very nervous about it because it was the fear of the unknown, obviously. It's just like putting numbing gel anywhere else. It felt a little bit weird on your face because you couldn't really feel like your lips and stuff like that. And of course, when the numbing cream wore off, it was even weirder. It's, you know, like
Get a little tingly.
Yeah, a little tingly, like your arm coming back from being asleep. You know, it wasn't horrible. I mean, it wasn't unpleasant or anything. It was just an odd feeling because, you know, kind of like couldn't feel your lips, couldn't feel your cheeks, you know, but other than that, it was fine. I didn't have any problems with it.
Perfect. Yeah, the numbing it's a very easy process, so it's no injectables as well, so it's nothing that we're going to have to no shots or anything like that. It's a little gel we place on before most of our procedures. M-Sculpt, it's not necessary with M-Sculpt, but for anything like Morpheus 8, where we're doing radiofrequency microneedling, or the soft wave, where there might be a little bit of some discomfort involved, we always use a lidocaine-based topical anesthetic, so it's going to be really comfortable for the patient. We're just here to make it as comfortable as possible. Nothing is going to be, you're not going to be jumping off the table in pain or anything like that, but just to make it a little bit more comfortable for the experience. And that one has to sit on the skin for a customized amount of time. So we'll let it sit for a little while, test it out. If you need it for a few extra minutes, not a big deal whatsoever, and we'll let it sit for pretty much however long you need, because everybody's a little bit different with how long it takes.
Yeah.
Absolutely. And again, with our field, it's important to treat the whole patient. And if they're having trouble with functioning and moving around with balance disorders, it's important to try to get a program designed where my patient is more stable on their feet, a lot stronger in the legs and core too. One of the things that can help in the aspect of weight reduction and toning is M-Sculpt. And M-Sculpt actually combines two things. It involves lipolysis or fat reduction. It also uses electromagnetic to get better tone of the muscle. Cool sculpting won't tone the muscle, and toning muscle is very important, especially on the things that we treat, like balance disorders. You need a strong core. It will help get you started, but my patient needs to maintain a strong core with doing interval strength training, and they got to get to the gym a couple nights in the week. But that can be a big help for that. It could be a big help for sleep apnea. In weight reduction for nose and sinus, there was a Canadian study recently that showed that obesity leads to a 2 to 3 times incidence of chronic sinusitis than normal weight. And the reason they feel is that obesity tends to have genetic factors that lead to a lot of circulating inflammatory factors that stir up the sinuses. So medically, it makes an important thing for the patient to continue their program to maintain an ideal weight status. Not only that, but strengthen the core. With an M-Sculpt patient that come in, where can they normally have the M-Sculpt performed?
So M-Sculpt is a wide variety of different areas. We can do it on biceps, triceps, all around the thigh area, the calves, the glutes, and then also our most popular one is definitely the abdomen area. It's a little bit of a problem area for both males and females. That lower abdomen is normally, it just tends to hold a lot more fat. And we can actually go in there and specifically place the applicator exactly where that patient needs the customization. So it is really great for any of those troublesome spots where maybe it's good for someone who's, maybe hits the gym pretty often, but they still have that one body area that just doesn't want to lose the fat or doesn't want to build muscle quite as quickly. We can actually kind of activate that very specific muscle. And since it's an involuntary contraction, you're not using any of that brain power. We're actually able to use 100% of the muscle, whereas in the gym, the normal average person is only using about 30% of that muscle. We can actually activate 100% of it. So we're getting a super maximal contraction is what they kind of call it. So we're able to really go in there and isolate specific muscles. So you get a little bit more of a workout than you normally would.
Absolutely. The other thing, if you have a patient that comes in and they have successful weight loss, they often get what's called stria or stretch marks. Mm-hmm. What are some of the things that are done to actually help treat that?
Yeah, absolutely. A lot of things after you lose weight, your body changes a lot, especially as you age. You don't have that elastin and that protein built up in your skin, so you do get things like the stretch marks. With that one, we go in with Morpheus to treat that. So what that is, Morpheus 8 is our RF microneedling. We're actually going in and able to create these microchannels in the skin, causing your skin to produce its own collagen and kind of strengthen it back up. And we're able to add the radio frequency, so the heat, to kind of help shrink and tighten everything as well. And doing that, it tightens, it helps with elasticity, so it really helps tighten the skin, but it also addresses that texture and the appearance of the skin. So we're thickening it back up, which dramatically reduces stretch marks.
And one of the other enemies of legs, successful people that stand a lot will often get spider veins
Yes.
in the legs just by the effects of gravity and prolonged standing. What modality do you normally like to use for?
Yeah, so we have Vasculase for that one. That one is a laser, so it's completely non-invasive. We're just going in there and we're able to kind of chop up a little bit of those veins, and it just makes the body's own lymphatic system carry them out. So you'll see a reduction within a couple days to about a week or so. It's a very quick procedure. It only takes about 5 or 10 minutes. It goes in there. We're not able to treat any of the larger size veins, like the varicose veins, with those, but any spider veins anywhere on the body we can treat with that.
Excellent. And then the other thing, many people when they were adolescents were really plagued by acne and have acne scars. And I understand that SoftWave may be an option.
Yeah, absolutely. So they actually just got their FDA clearance in Europe for acne reduction scars. So it's a really amazing. They're getting that clearance, and so these things are very much scientifically backed, third-party studies to reduce these acne scars we're seeing. And acne scarring is one of the harder things to help with skin, because it's so deep into the skin. These are they call the ice pick mark, so they're kind of little divots created into the skin, and they're so deep into healed skin that sometimes even with microneedling and that kind of thing, it still takes a while to treat. But with SoftWave, we're actually non-invasively able to go in there and really strengthen that skin back up. So it's a great option for people.
Gotcha. Melanie, as a patient, what do people look for when it comes to their medical care, or for when they have procedures done?
For instance, with this, I had been thinking about filler for a really, really long time, especially around my mouth and stuff. And when you told me that this was coming, I was like, man, this is my body using its own stuff to get rid of the wrinkles. I'm not putting anything foreign in my face, not knowing how I would react. I had Botox at one point, did not have a great reaction to it for me. I didn't. I had a headache, for a while. So I wanted to try to do something naturally, because, as you get older, like me, you're taking the collagen pills, you're taking the hyaluronic acid, you're doing all of the skincare, but sometimes skincare isn't enough. So this was perfect. I wanted something that I know was going to work. I'm a researcher, so when I find out about stuff, I go online and look at pictures, I read the studies that were done to it, what the results of the studies were, different things like that before it gets done to me, because I feel that that's important just for me as a patient, to be an advocate for myself, to know what I'm getting myself into. But people have stopped me that I haven't seen in like a month, and just a photographer had made a joke the other day. She said, I don't have to take your pictures up anymore, So I was like, okay, you don't have to then. So, but other than that, that's, I just want to make sure I do my homework on anything that I do on my body or to my body, to make sure that it's going to be the right thing for me.
Yeah, and it's important when your medical staff does that work for you as well. Like as someone who's in that industry, I love hearing people say that they do their research, because it's so important. These things, like the industry is evolving so quickly, and it's very important that we look into the devices that we have and know that these are third-party clinical studies backed. I mean, these are devices with years and years and years, sometimes decades of scientifically backed data, and it's a very important way to conduct business.
Absolutely. And as I was mentioning earlier in the show, I love when people tell their friends, but even still, any procedure that's done medically, many things important to protect. One is privacy. Patient privacy is always important. You can't do patient privacy if you're doing a party to Botox and filler. per se, unless it's done at a clinic where the patient could be brought back individually. And I always think that's important. Informed consent's important too, that the patient goes there because they want to have it done, not that they're being pressured by their peers or forced to have it done, is another important thing. I always like to be involved with it as the physician because especially if I'm doing the procedure, like with in-office sinus procedures, or if I'm doing Botox and filler, I want to see the patient initially to plan out what they need. And then I want to, of course, do the procedure all to my own. And then I want to follow up the result, not having somebody else follow up, because I want to know how it worked. And that's always good, because if it didn't get the expected result, then we could determine why and make any adjustment to make it better. But I think that's one of the important parts of doing that. And as a physician, the good peace of mind is that whether it's in-office sinus procedures or whether it's in-office aesthetics procedures, we've got 24/7 physician coverage with my call team. So if anything happens out of the ordinary, then they are familiar with it. ENTs operate and do procedures on the face, so they're going to know, what the patient calls about. The same with nose and sinus. If there's anything that occurs, and occasionally it does, no matter what the circumstance, that you've got a qualified physician that's on call 24/7 for the procedures.
Definitely.
But I appreciate everybody tuning in, and I look forward to the next segment of Riesberg Institute. Thank you very much. I'm Dr. Michael Riesberg.
Being prepared is a part of who you are, but it's especially important in the case of a disaster. Be informed about possible emergencies in your area. Make a plan that covers where you'll go in an emergency. Build a kit with the things you need to survive. There's no one more capable of planning for your situation than you. Start your plan today. Go to ready.gov/myplan.